what if your body's defense system, the one that's supposed to protect you, what if it kind of went rogue?
Oh, that's a scary thought.
Yeah, and that's the reality of hemophagocytic lymphohistiocytosis, or HLH.
HLH,
Yeah,
yeah.
HLH.
Right.
And you sent over some really in-depth research on this, and I was hoping maybe we could kind of explore it together.
Absolutely.
What HLH is, how on earth it's diagnosed, and what causes it, what triggers this, potentially life-threatening condition.
Yeah, it's fascinating stuff, but it's pretty complex.
Yeah.
I mean, just imagine your immune system, the thing that's supposed to be protecting you, suddenly deciding to attack your own body.
That's kind of terrifying. So essentially we're talking about like the immune system going haywire.
Exactly.
Okay, so could you break it down for us a little more? What exactly is HLH, and what's actually happening within the body when someone has it?
So HLH is actually a syndrome, not a single disease.
Okay.
And it's characterized by this overactive immune response that just spirals out of control. And so instead of, doing its job, fighting off infections or whatever threats, it starts attacking healthy tissues and organs,
Oh, wow.
leading to massive widespread inflammation.
So it's like friendly fire,
Yeah,
but like on a cellular level.
exactly. That's a great way to put it.
Okay, and you mentioned there are two main types.
Right.
Primary HLH and secondary HLH.
Yeah, you got it. Primary HLH, also called familial HLH, comes from inherited genetic defects. These defects, what they do is they disrupt the mechanisms that allow our immune cells to actually kill off infected cells.
Oh, wow.
And sadly, it usually shows up in infants and children.
Yeah, and the research we have really emphasizes, how important it is to pinpoint the specific gene variant to confirm this diagnosis.
Oh, absolutely. Pinpointing that genetic culprit is crucial,
Yeah.
not just for diagnosis, but also for understanding, what's at the root of this immune dysfunction.
Yep.
But then we have secondary HLH, which, unlike the primary type, is acquired, so not inherited. It's seen more often in adults.
Interesting.
And it can be triggered by, a whole bunch of things: infections, cancers, even autoimmune diseases.
So in secondary HLH, the immune system is basically tricked into this overdrive state.
Ah, you could say that.
Okay, so then how do doctors even tell the difference between the two, especially since they can present with similar symptoms?
Well, you've hit on one of the biggest challenges with HLH diagnosis.
Right.
It's a real puzzle, even for the most experienced clinicians.
Really?
Yeah, and, recognizing the possibility of HLH in the first place, that's paramount, because early treatment, that's absolutely critical.
So we're talking about a race against time, basically.
Pretty much.
And our sources, they highlight persistent fever as a real hallmark sign, often one of the first things that pops up. Right?
Yeah, that's a big one.
But I'm guessing there's more to look out for.
You bet. Along with that unrelenting fever, you often see an enlarged spleen and liver. Think about it. These organs are working overtime trying to filter out the inflammation and the cellular debris caused by, the immune system going on a rampage.
Yeah, that makes sense. And you've also got cytopenias, which are basically low blood cell counts, right?
Right? Cytopenia.
The up-to-date source gives us some great relatable examples. Anemia causing fatigue, easy bruising from low platelets, and higher risk of infections.
Yeah, all those things.
So it's like the body's, its workforce is being depleted in this internal battle.
That's a great way to put it.
And then on top of all that, there's liver dysfunction, which
Wow.
can lead to a whole cascade of problems, right?
Exactly, yeah.
I mean, the liver's vital.
Oh, it is.
And HLH can disrupt its normal function, potentially causing hepatitis, jaundice, even problems with blood clotting.
Right.
That's like this immune storm just wreaks havoc on the body's balance.
It really does.
But I mean, it doesn't stop there, does it? HLH can also affect the brain.
You're right, it can.
That's scary.
It can cause neurological problems, ranging from seizures to changes in mental status.
Wow.
And sometimes, actually, those neurological symptoms, they might even be the first warning sign even before the other, more classic signs show up.
That's terrifying, and it makes diagnosis even more difficult.
Oh, it does.
It's like the symptoms are almost a smokescreen,
Yeah.
masking the real problem.
Yeah.
So we've got this out-of-control immune response, but there's one clue that seems to stand out in the research, and that's ferritin.
Ah, ferritin, yes. Ferritin's a protein that stores iron.
Okay.
And in HLH, its levels go through the roof. I mean, far beyond what you'd see in a normal infection.
So that's a pretty big red flag for doctors.
It is. It is.
So, okay, picture this. A patient comes in with a bunch of these symptoms, and their ferritin levels are just off the charts.
Yeah.
That should raise a pretty strong suspicion of HLH,
Yeah,
right?
it should. It should.
But you mentioned earlier that it's not always, clear-cut situation, presently in adults.
That's true, especially in adults. You see, high ferritin can also be caused by other things.
Right.
So it's not a, 100% diagnostic marker on its own,
I see.
especially in adults where other factors might be at play.
So it's just one piece of a very complex puzzle.
Yeah, you could say that.
All right, well, let's shift gears a bit now and talk about what actually sets off this immune storm in the first place,
Okay.
particularly in secondary HLH.
Right.
What are some of the triggers for this whole cascade of events?
Well, infections are a major culprit.
Okay.
We're talking viruses like Epstein-Barr, bacteria, parasites, fungi.
Mm.
All these things can trigger an immune response, but sometimes that response just goes into overdrive, leading to secondary HLH.
And the research really highlights Epstein-Barr virus, or
Oh,
EBV,
yeah, EBV.
and how it can actually suppress the immune system's ability to kill infected cells.
Right.
So it's like it creates the perfect environment for HLH to develop.
Exactly.
Okay, then you've got cancers, particularly lymphoma and leukemia.
Right, those are big ones.
And malignancy-associated HLH, that sounds particularly scary
It is.
because now you're dealing with both the cancer and the immune dysregulation.
It's a double whammy.
Wow.
Yeah.
And then finally, autoimmune diseases, where the immune system is attacking its own tissues. They can also be a trigger.
They can. Things like lupus or Still's disease.
Right.
These conditions, they keep the immune system in a heightened state of activation.
And that can sometimes escalate into full-blown HLH.
Unfortunately, yes.
So we've got infections, cancers, and autoimmune diseases as these three major triggers.
Those are the big three.
But underlying all of this, there's the crucial role of genetics, isn't there?
Oh, absolutely. Genetics are key, especially in primary HLH.
Okay.
It all comes down to mutations in genes that affect lymphocyte cytotoxicity.
So basically, these mutations disrupt the immune system's ability to, hit its targets.
Exactly.
Like having a faulty weapon in the body's defense arsenal.
Great analogy.
And the research you sent over, it goes into great detail about the specific genetic mutations involved.
Yeah, it's fascinating stuff.
And how even subtle changes in these genes can really have a profound impact on how the immune system functions.
It's amazing how these tiny changes can have such big consequences.
It really is. And the research you've provided details the complex genetics behind familial HLH.
Right.
Turns out that even the smallest glitches in these genes can disrupt how your immune cells fight off threats.
Exactly.
And that leaves you vulnerable to developing HLH.
It does.
But here's where it gets really interesting. The research suggests that even a single mutation in some of these genes can increase your risk of developing cancer later in life.
That's right.
Wait, so just one mutation could increase cancer risk?
It can.
That completely changes how we think about HLH.
It does.
It's not just the immediate threat of the syndrome, it's the potential long-term consequences as well.
You've hit the nail on the head.
I think we need to unpack this a little more.
Absolutely.
So understanding the genetic basis of HLH is clearly crucial, not just for diagnosing and treating it, but also for identifying people who might be at higher risk for other health problems down the line.
Exactly. It's about prevention as much as it is about treatment.
It really highlights how everything in the body is connected,
It does.
how a seemingly small glitch in one system can have these ripple effects on your overall health.
That's the amazing and sometimes scary thing about the human body. Everything is connected.
Well, this is fascinating, but we're just getting started, right?
Oh, yeah, we've got a lot more to cover.
Okay, great.
Yeah.
Why don't we take a quick break and then come back and delve deeper into how doctors actually diagnose HLH and what treatment options are available.
Sounds good to me.
It really is a case where, knowledge is power.
It is.
Early diagnosis is critical.
Absolutely.
So let's talk about how doctors actually go about diagnosing this condition.
Okay.
Our sources kind of make it sound like detective work.
It is a bit like that.
Yeah.
It starts with, recognizing the possibility of HLH in the first place. Doctors need to have it on their radar, especially when they're dealing with patients who have those telltale signs we talked about earlier, unexplained fevers,
Yeah.
cytopenias, enlarged spleen or liver.
But the up-to-date source, it really stresses that a high index of suspicion is crucial
It is.
because HLH can mimic more common infections.
Oh, absolutely.
So it's easy to miss.
It is. It can be very tricky.
So doctors can't just rely on a checklist.
They can't.
They have to consider the whole picture.
Whole picture.
The patient's history, symptoms, test results, everything.
Exactly.
And thankfully, there are some diagnostic criteria to help guide doctors.
Right.
The HLH 2004 trial That established a set of criteria that have become the standard for diagnosing HLH.
Right, the HLH 2004 criteria.
And they include things like fever, splenomegaly, cytopenias in at least 2 blood cell lines,
Right.
high triglycerides or low fibrinogen, hemophagocytosis in the bone marrow or other organs, high ferritin, low or absent NK cell activity, and elevated soluble CD25.
It's quite a list.
Yeah, it is. It is.
And it just highlights how complex diagnosing HLH can be.
Yeah.
Not every patient is going to meet all the criteria.
Right.
And sometimes treatment needs to be started even before all the criteria are met,
Wow.
especially in really sick patients.
So it's not a black and white diagnosis.
No, not at all.
There's a lot of gray area.
There's a lot of gray area.
Clinical judgment plays a huge role.
It does.
Okay, so doctors will often use additional tests to confirm their suspicion.
Right, right.
Things like ferritin, SCD25, CXCL90, these are all markers of inflammation and immune activation.
They are.
And if those markers aren't elevated, it makes HLH less likely.
Much less likely.
And doctors should consider other diagnoses.
Exactly.
So it's like narrowing down the possibilities.
Yeah, eliminating the unlikely suspects.
And then there's the bone marrow evaluation.
Ah, yes, the bone marrow.
Crucial step.
Absolutely crucial.
This is where they look for evidence of hemophagocytosis.
Right, hemophagocytosis.
Which is the process where activated immune cells, specifically macrophages, start engulfing other blood cells.
Yeah, it literally means blood eating.
Wow, okay.
That's where the condition gets its name from.
That makes sense.
Hemophagocytosis.
But our sources also mention that it's not always present in HLH.
You're right, it's not a foolproof sign.
And it can occur in other conditions too.
It can.
So while it's a strong indicator,
It is.
it's not a definitive test.
Nope.
You still need to consider all the clinical and laboratory
The
findings
whole picture.
to make an accurate diagnosis.
Exactly.
Okay, so we've got the symptoms, blood work, bone marrow evaluation, and those diagnostic criteria.
Right.
But there's also genetic testing,
Oh, absolutely. Genetic testing is critical.
especially for diagnosing familial HLH.
Especially for familial HLH.
Helps pinpoint the specific gene mutations
Right.
that are causing the problem.
Leader at the root of the immune dysfunction, yeah.
And our sources recommend genetic testing for all patients who meet those diagnostic criteria for HLH,
They do?
as well as anyone with a strong suspicion of the condition, based on their initial evaluation.
It's important to be thorough.
And genetic testing not only confirms the diagnosis, but it also provides valuable information for family members.
No, absolutely.
Because they might be carrying the same mutations
They might.
and could benefit from early screening.
Exactly. Early screening or even preventative measures.
Wow. It's like having a glimpse into the blueprint of a person's immune system,
It is. It's like having a peek under the hood.
revealing those potential vulnerabilities.
Yeah, and with HLH, those vulnerabilities can be, well, life-threatening.
Yeah.
But thankfully, once you have a diagnosis, there are treatment options available.
Okay, good.
So let's talk about treatment.
All right, so I know the approach depends on the type of HLH
It does.
and the severity.
Yeah.
But can you give us a general overview of what's involved?
Sure. For primary HLH, the goal is to suppress the overactive immune response
Okay.
and then ideally cure the condition with a stem cell transplant.
So you're talking about replacing the faulty immune system with a healthy one from a donor.
Exactly, like hitting the reset button on the immune system.
And the research highlights some pretty remarkable success rates with stem cell transplants.
It does.
In specialized centers,
Right.
post-transplant survival rates can reach as high as 85 to 100%.
That's incredible.
It's truly life-changing for these patients.
It is. It's amazing what medical science can do these days.
It really is. But before a stem cell transplant can even be considered,
Right.
patients usually receive a combination of chemotherapy and immunosuppressive drugs.
Yes, to get that immune storm under control.
Our sources detail these treatment protocols, with the HLH-94 and HLH-2004 protocols being the most widely used.
Right. Those are the standard protocols.
And these protocols involve a combination of drugs, typically etoposide, dexamethasone, and cyclosporine.
Yes, those are the big three.
And each target different aspects of the immune response.
Exactly. They work together to tamp down the immune system's activity, give the body a chance to recover.
It's a delicate balancing act, isn't it?
It
It's
is.
suppressing the immune system enough to control the HLH,
Right.
but not so much that the patient becomes vulnerable to other infections.
That's the challenge.
But thankfully, there are some new treatments on the horizon.
There are some exciting new developments.
The research mentions alemtuzumab, a monoclonal antibody that targets a protein found on lymphocytes,
Right?
and imapilumab, an antibody that blocks interferon gamma, a key cytokine involved in the inflammatory cascade of HLH.
Those are both very promising treatments.
They offer hope for even better outcomes in the future.
They do.
But for now, those established protocols, like HLH-94 and HLH-2004, remain the standard of care.
They do. They have a proven track record.
So we've talked about primary HLH,
Yeah.
but what about secondary HLH?
Okay.
How does the treatment approach differ?
Well, with secondary HLH, the focus is often on addressing the underlying trigger.
Okay.
So if it's an infection, you treat the infection aggressively.
Right.
If it's cancer, you treat the cancer.
So it's about tackling the root of the problem.
Exactly. You have to address the underlying cause.
But I'm guessing it's not just about treating the trigger.
No, it's not.
Doctors also use medications to dampen the immune response
They do.
and manage the organ damage that's already been caused by HLH,
Right. It's a two-pronged approach.
tackling both the cause and the consequences.
Exactly.
And our sources mention a number of different treatments that can be used. Glucocorticoids, intravenous immune globulin, anakinra, ruxolitinib.
Right. All those can be helpful.
Each one plays a specific role in modulating the immune response and reducing inflammation.
It's amazing how many tools we have now to manage HLH.
It is. It's impressive.
But sometimes, even with secondary HLH, doctors might consider a stem cell transplant.
Really?
Yeah, especially if the condition is severe or doesn't respond to other treatments.
So it can be a life-saving option, even in secondary HLH.
It can be. It's usually reserved for the most severe cases, but it's definitely an option.
So regardless of the type of HLH
Right.
or the specific treatment,
Yeah,
the message from the research is clear.
it is.
Early diagnosis and prompt treatment are absolutely essential.
Couldn't agree more.
The longer HLH goes unchecked,
Right.
the greater the risk of complications,
Absolutely.
organ damage, infections, even death.
It's a race against time.
And that's why awareness is so vital.
It is.
Not just for doctors,
Right?
but for everyone.
Absolutely. Knowledge is power, and in the case of HLH, it can be life-saving.
But we haven't even touched on one particularly interesting subtype of secondary HLH,
Oh, right.
macrophage activation syndrome, or MAS.
MAS.
It's a unique twist on this already complex condition.
It is.
And I think it deserves its own spotlight.
I agree.
So why don't we jump into that now?
Let's do it.
Okay, so macrophage activation syndrome, or MAS for short.
MAS, yeah.
It sounds pretty intense.
It can be. It's
Okay.
basically HLH, but it's specifically triggered by an autoimmune disease. So instead of, going after an infection or cancer, the immune system starts attacking the body's own tissues.
Oh, wow. So it's like the immune system is confused.
Yeah, you could say that.
And it's attacking the wrong target.
Exactly.
What's really interesting is that the research actually suggests that MAS should be viewed as a form of HLH,
Right.
not as a separate entity.
Yeah, I think that's an important point.
Okay.
It helps us understand that the underlying mechanisms are similar
Yeah.
and the potential consequences are the same, even if the initial trigger is different.
So it's a subtle but crucial distinction.
It is.
Okay. And these sources go into detail about the specific autoimmune conditions that are linked to MAS. Systemic, juvenile idiopathic arthritis, adult onset, Still's disease, systemic lupus erythematosus.
Yeah, all of
It's
those.
like a who's who of autoimmune disorders.
It is.
And all these conditions keep the immune system in a constant state of activation.
Yeah, chronically activated.
And sometimes that can escalate into a full-blown MAS episode.
Exactly.
There's a really interesting question that the research poses.
Okay.
Could interleukin-18 overproduction
Right.
play a key role in MAS,
That's a good question.
specifically in conditions like Still's disease?
That's a fascinating area of research.
Yeah.
If interleukin-18 is driving this targeting, it could be a potential therapeutic strategy. And it really highlights how important it is to understand those specific pathways
Right.
that are causing the inflammation in different HLH subtypes.
So how is MAS diagnosed and treated? Is it similar to other forms of HLH?
Yeah, pretty much.
Mhm.
Diagnosing MES, like other forms of HLH, relies a lot on clinical suspicion.
Right.
Doctors need to be looking for those telltale signs: persistent fever, cytopenias, liver dysfunction, elevated ferritin. And of course, they need to consider if there's an underlying autoimmune disease.
Yeah, it sounds tricky,
It can be.
especially with those neurological symptoms we talked about,
Yeah,
which can sometimes be the first sign.
they can be very misleading.
So it really requires doctors to be super aware of this condition.
It does.
And treatment typically starts with high-dose glucocorticoids.
Yes, things like methylprednisolone.
And those are powerful anti-inflammatories.
They are.
They can quickly calm down that overactive immune response.
They can, but sometimes they're not enough.
Oh, okay.
Sometimes you need other immunosuppressive drugs like cyclosporine.
To really get the immune system under control.
Right.
And one of the sources even mentions anakinra
Yeah.
as a potential option, especially since it targets interleukin-1.
It does.
Which we just talked about.
Right, so it's a more targeted approach.
Yeah, it seems like we're moving towards more targeted therapies.
We are, which is really exciting.
That is exciting.
As we understand these mechanisms better,
Yeah.
we can develop more targeted and more effective treatments.
But for now, the mainstay of treatment is still those immunosuppressive drugs.
It is, for the most part.
Along with closely managing the underlying autoimmune condition.
Exactly. You have to address both sides of the equation.
So, again, it's a multi-pronged approach.
It is.
Tackle the trigger and the immune dysregulation itself.
Right.
And just like with other forms of HLH,
yes,
early diagnosis and prompt treatment are absolutely crucial.
Absolutely. Can't emphasize that enough.
To prevent those severe complications.
Right. Those complications can be very serious.
Well, this has been an incredibly informative deep dive.
It has been.
We've covered a lot of ground.
We have.
The basics of HLH.
Yep.
The complexities of familial HLH.
Right.
And even the unique challenges of MAS.
It's been a whirlwind tour of HLH.
It really has.
Yeah.
And it's clear that HLH, in all its forms, is a serious condition.
It is. It shouldn't be taken lightly.
But the research you provided, it really does offer hope.
It does.
With increased awareness, earlier diagnosis, and these advancements in treatment.
Right. We're making progress all the time.
We can improve outcomes for people affected by HLH.
Absolutely. The future is looking brighter.
So before we wrap up, any final thoughts for our listeners who have, followed us on this journey through the world of HLH?
I'd say this. We often take our immune system for granted. It's this amazing system that protects us every day.
It does.
But HLH reminds us that even our most powerful defense systems can malfunction.
Yeah.
And when they do, the consequences can be devastating.
It's a reminder of how delicate the balance is within our bodies.
Exactly.
And we've only just scratched the surface of this complex condition.
We have.
So if you're left with questions, and I'm sure you are, I encourage you to delve deeper into the research we've discussed today.
It's fascinating stuff.
And of course, for personalized guidance, always consult with a qualified healthcare professional.
Absolutely. They can provide the most up-to-date information.
Tailored to your specific needs.
That's right.
Well, thank you for joining us on this deep dive into the world of Hemophagocytic Lymphohistiocytosis.
It's been a pleasure.
We hope you've come away with a greater understanding of this rare but impactful condition.
I hope so too.